Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then the drug disopyramide. Disopyramide is a class 1A drug. It has anticholinergic activity and it is actually avoided in elderly. It is also used in hypertrophic obstructive cardiomyopathy and it has high negative inotropic action. It has high negative inotropic activity and it is useful in reducing the muscle mass. It is useful in reducing the muscle mass in the patients. So mainly disopyramide is an anticholinergic activity. It is mainly avoided in elderly and it is used in hypertrophic obstructive cardiomyopathy.
thank you and thank you for watching.